Good afternoon, my people. Let me start by welcoming and also appreciating those who have been supporting my channel, especially the returning subscribers. Feel appreciated. And anyone who is doing anything, however little it is, to support this channel or to push it forward, feel appreciated. And for those who have not subscribed, or to the new subscribers, feel appreciated also. And let's continue subscribing, liking and sharing our videos so that they may be recommended all over in the world. And after you subscribe, don't you forget to hit the notification bell or to put the notification bell on, so that whenever I make any video or upload any video, YouTube will automatically notify you. Let's get back to our topic of discussion, whereby we are discussing about family planning for the better part of this month. And more specifically, we are tackling about the permanent birth control methods. Yesterday we discussed about vasectomy that can only be done to men, and today we are going to tackle tubal ligation. We said that vasectomy is for those who have testicles. The same way, tubal ligation is for people with fallopian tubes. That means it can only be done to women or ladies only. You cannot do a tubal ligation to a man. So, tubal ligation. It's a procedure that happens to people with fallopian tubes. That is specifically the ladies. Because you can't tell me that a man has a fallopian tube. It involves, get it very clearly, it involves blocking, tying, or cutting the fallopian tubes. It involves blocking, tying, or cutting the fallopian tubes, which transport the egg from the ovaries to the uterus. Tubal ligation involves blocking, tying, or cutting the fallopian tubes, which transport the egg from the ovaries to the uterus for fertilization to take place. When the egg cannot reach the uterus, it means no pregnancy. No ovum, no pregnancy. It's always 99% effective. And what are the advantages of tubal ligation? Tubal ligation is a permanent birth control method. While you may have a small chance to be able to reverse the procedure or get pregnant via vitro fertilization afterwards, but there is no guarantee. Let me repeat this. It's 99% effective. Its advantage is that tubal ligation is a permanent birth control, while you may have a small chance to be able to reverse the procedure or get pregnant via or through vitro fertilization afterwards, but there is no guarantee. That means the chances are 50-50. After tubal ligation, you may get pregnant or you may not. The disadvantage. One of the disadvantages is that it's surgery. Though it's a same-day procedure, doctors will occasionally use a method that requires incision. It's surgery, though it's a same-day procedure. doctors will occasionally use a method that requires incision. There is a misconception that tubal ligation will stop your periods completely, but it doesn't. Those who believe that tubal ligation will stop your periods, it doesn't. So just remove that misconception from your mind, because it doesn't stop your periods at all. A point to note: if taking testosterone, there is a common misconception that people assigned female at birth are taking testosterone can't or cannot get pregnant. That's not always true as per trauma focused therapists and sexuality educator. Let me repeat this one. There is a common misconception that people assigned female or females taking testosterone cannot get pregnant, and that's not always true as per trauma focused therapist and sexuality educator. That was a study that was carried to determine whether people or ladies taking testosterone can get pregnant, and it was proved that they can become pregnant. So those who say that when taking testosterone you can become pregnant, that is a misconception, and it should be abolished from your mind. Another point to note: if you have not undergone bottom surgery, pregnancy is still possible. Another point to note: unless a medical provider or a doctor has told you that you are sterile or unable to get pregnant, assume pregnancy is a risk. Unless a medical provider has told you that you are sterile or unable to get pregnant, assume pregnancy is a risk. Depending on the anatomy of your partner and the type of sex you are having, you may want to look into birth control or start a birth control program. Depending on the anatomy of your partner and the type of sex you are having, you may want to look into birth control or start a family planning method or have a contraception or a contraceptive to prevent pregnancy. Another point to note: any of the above birth control methods are an option, including the hormonal methods, hormone replacement therapy and hormonal birth control can be used together. Any of the above birth control methods are an option, including the hormonal methods, hormone replacement therapy and hormonal birth control can be used together. This marks the end of our video today. Thank you for being with me. Thank you for your time. And let's continue subscribing and encourage those who have not subscribed to continue supporting our channel so that it may grow bigger and bigger. Let's meet in the next video.